Hello, this is Janet Michael. In addition to hosting the Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to the Valley Today. I am your host, Janet Michael. Happy Thursday as you are listening to the show today. We, however, have pre-recorded our conversation on the Zoom screen. It is Valley Health Day. This is part of our community health partnership with Valley Health, where every month we talk to an administrator, a physician from Valley Health about a different health topic. It's also Camping for Hunger Week, so our topic this week is kind of tailored a little bit more to Camping for Hunger. Remember, the bus is parked at the radio station this year. It is at 1106 Elm Street. You can drop off your food and monetary donations there from 9 a.m. until 4 p.m. If you don't want to leave your house, you can head over to the River 953's Facebook page, and at the very top of our Facebook page, you will see a link where you can make a monetary donation through PayPal. You don't have to have a PayPal account. You just click the link. You can add your checking account or credit card number, and 100% of that money goes to Front Royal Warren County CCAP. So, ladies, I want to thank you both for coming to chat with me today.
Hello. Hi. Thanks for having us.
So on the Zoom screen with me today is Susan Lessar. She is a certified nutrition support clinician and the director of Valley Health's nutrition therapy program. Jessica Watson is also on the Zoom screen with us. She is with the Valley Health Chronic Disease Resource Center. We're going to talk about something that I don't think a lot of us think about when we think about food insecurities and food pantries. We're going to talk a little bit about nutrition and malnutrition. Susan, I understand you have a blog on Valley Health's website that talks a lot about nutrition. Tell me a little bit about that.
I don't know that I would necessarily call it a blog. I did an article for Malnutrition Awareness Week back in October to highlight the consequences of malnutrition and how to identify and treat it.
We've been doing Camping for Hunger now at the station. I think this is our 12th or 13th year. It's a little different this year because of COVID-19, and CCAP has put some things in place to have people give monetary donations a little bit easier than bringing food. But I've noticed over the years of sitting on the bus and collecting food donations, sometimes some of the food that comes in isn't necessarily the healthiest food that people should be eating on a regular basis. Tell me a little bit about how we should know what's good for us to eat and what's not.
You know, that is probably going to be an ongoing challenge just because a lot of times the foods that are donated during food drives are non-perishable. So those are going to be our items that are going to have a lower nutrition content and they're shelf stable. So they're going to be higher in preservatives and our simple carbohydrates and not necessarily give us a lot of nutrition benefit. However, it is still a calorie source, which can help prevent malnutrition.
Larry from CCAP was on the show with me on Monday, and we talked briefly about when I am donating to a food pantry, whatever I am at the grocery store buying for my family, I will just pick up a couple extra cans of that versus buying something that I think might be cheap or easy to donate, which typically is a lot of those more unhealthy types of foods.
Yeah, and so I think what you're doing is a great idea. And at the same time, our local grocery stores often run sales on items where, you know, the more you purchase, the cheaper it becomes. So if it is a healthy item that happens to be on sale, I think that's an excellent idea in order to increase the nutritional value of the foods that are donated.
I'm thinking that years ago, fresh foods, produce weren't really something you could find on a food pantry shelf. And they're becoming much more readily available these days because grocery stores are donating them to food pantries. There are a lot of community gardens. We're going to talk about one that you guys are involved in a little bit. But how important is fresh food and fresh produce in somebody's overall diet?
Well, it's obviously the preferred source of vitamins and minerals, from fruits and vegetables. However, we dietitians do often recommend that if fresh produce is not an option, frozen is always another good backup. So fresh and frozen is always better than our canned fruits and vegetables. So even if you don't have access to fresh produce, you could still purchase frozen.
Jessica, you deal a lot with patients who are suffering from chronic disease like kidney disease, heart disease, diabetes, things like that. What you eat plays a large role in how you can manage those diseases, doesn't it?
Absolutely. And many of the various chronic illnesses have diet-specific requirements that help them manage that disease better for them to stay well.
Elise and I from United Way of Northern Shenandoah Valley had a conversation earlier this week, and we were talking about how so many people that are struggling with a food insecurity will forego getting their medication. Maybe they'll not take all of the insulin that they need for their diabetes in order to put food on the table. Do you see that a lot in your practice?
We do see that in some of our outpatient clinics where patients are making the decision between food on the table and being able to afford their medications. And so we try to find ways that we can help connect them with nutritional foods that help support their diet that's reasonable, as well as help them connect them to resources to help supplement their medication expense.
Susan, when you talk about malnutrition, the first thing, whether it's right or wrong, the first thing that pops into my mind are those commercials you used to see on television about the starving children in Ethiopia. I think we all as parents have given our kids a bit of grief at the dinner table about not cleaning their plate. Explain to me what malnutrition is, because I think it's a little more complicated than people think it is.
Sure. So malnutrition occurs when there's an imbalance between what you eat and what you need to maintain good health. And like you said, referenced in the commercials from long ago, malnutrition comes in many shapes and sizes. So it's easy to see a patient with a low BMI and recognize that malnutrition, but it's harder when you have patients that are obese and are malnourished. So just because a patient is overweight does not mean that they're not malnourished. And we see that a lot in patients that either make poor food choices. Unfortunately, some individuals in our community go through the fast food line, breakfast, lunch, and dinner. And so their intake is high in calories, probably high enough in protein, but not meeting their vitamin and mineral requirements and calcium and all those things. And then the other type of malnutrition that we can see in an overweight individual is someone that suffers from chronic disease or cancer, where they might have had a BMI of 40, and in the last 3 months, it's dropped down to a BMI of 35. They still appear to be overweight, but they are clinically malnourished due to the rapid, unplanned weight loss that is occurring from body fat as well as muscle tissue.
And as someone who works, and both of you work with patients that are dealing with nutrition on a regular basis, you mentioned a second ago, eating at the drive-through 3 times a day. That is sometimes it's convenience for the, I will grant you a lot of times it is out of convenience, but it's also a very inexpensive way to eat when you think in terms of you could get a meal at McDonald's for like $6. That is a cheap way to do it versus going to the grocery store, which requires a little bit more of an education on what to buy. It requires education on how to prep those foods.
Yes. Unfortunately, we do see a lot of fast food eating, in particular with parents that have busy schedules with kids and individuals that aren't home as often to prepare meals, like truck drivers. So they're the ones that really hit the fast food restaurants pretty hard. Historically, it is viewed both within fast food and in the grocery stores that eating healthy does cost more money. And that's true to an extent. However, there are resources out there. I know that Valley Health has created one that we would be happy to share that was given to our free medical clinic, where we gave an intern a certain amount of money. Let's say it was $100 for the entire month. And she came up with a grocery list. And then based off of that grocery list, what were the different, the breakfast, lunch, and dinner that you could create out of that amount of groceries, as well as the recipes. So it really showed a way to, to stretch that food. So for example, on a Sunday night, there might have been a beef roast that you cook for dinner. And then on Wednesday or Tuesday, you make some type of like a quesadilla that's, has the chicken and that leftover roast. So ways to help stretch your dollar and shop in a healthier manner.
Do you guys work with patients directly a lot on those types of things when you're talking to them about their nutrition, and offer suggestions for meal prep, like you said, on a Sunday night, and using the leftovers throughout the week in order to help them maybe stay away from foods that aren't as healthy?
We certainly can. We typically find that when patients are in the hospital and acutely ill and they're getting new information and new diagnoses, it's not always the best teachable moment, just because they have other things on their mind, like they've got to get back to work, they've got bills piling up, who's taking care of their cat. So when the dietitian walks in and talks about, your eating habits and meal planning and things to change, it's probably not the best time to have that conversation, because the patient honestly isn't always, they're not in a good place yet to hear that information. So we do our best. We kind of put a Band-Aid on it. And if the patient wants to learn more, we certainly are happy to do that. A lot of times we just give them the basics and encourage them to follow up with an outpatient dietitian. They're also the Academy of Nutrition and Dietetics, due to COVID, they're offering telehealth visits. So that is certainly another thing that an individual in the community or someone that's recently discharged from the hospital could take advantage of.
I've talked on past episodes with various people from our local extension offices. They have a nutrition person that is part of the extension office, and they do a lot of recipes. They have websites where people can go and find to do things. Do you have resources for people like that you can say, well, here's a place where you can go and start to begin your journey to know a little bit more about the food that you're eating?
We do. We have those resources, as well as a community resource guide that we can share with patients on area food banks and soup kitchens and places where they can go to pick up fresh fruits and vegetables, like the things that are donated from Martin's and our other local grocery stores.
Well, let's take a quick break. When we come back, can we talk a little bit about the community garden? And I want to ask you ladies about a term that I've heard a lot on the news in the last 6 months, called food deserts. So can we talk about food deserts and community gardens when we come back in the next segment?
Absolutely.
Sure.
All right, we are on the Zoom screen today with Susan Lessar and Jessica Watson. They are both from Valley Health. We are talking about food insecurities and malnutrition, how you can eat a little bit healthier these days, all because it is Camping for Hunger Week, and we are at the station from 9 a.m. to 4 p.m. accepting your donations. We'll finish this conversation in just a couple of minutes.
Do you know anyone who is struggling with financial hardships because of coronavirus? Our new webinar called Coping with the Money Crunch can help. We'll talk about immediate options to consider, revising or creating a spending plan, and lots of community resources. Then we'll cover how to narrow your priorities, contact creditors, and avoid scams and risky loans. The webinar is free, and you can either join by phone or through Zoom on a smartphone, tablet, or computer. You can find out more by visiting the Northern Shenandoah Valley Financial Education Program on Facebook, or calling Karen Poff at 540-635-4549. Let me show you how to make your own plan or help someone you care about get through the crisis. Call 635-4549 or visit at NSV Financial Education on Facebook today.
Welcome back to the Valley today. I am your host, Janet Michael. It is Thursday as you are listening to the show. We, however, have pre-recorded our conversation on a Wednesday afternoon. It is Camping for Hunger Week at the station. Somebody is at the bus just waiting for you to come by with your non-perishable food items. Remember, things like laundry detergent, soap, toothpaste, personal hygiene items are also very much needed for Front Royal Warren County CCAP. You can make a monetary donation at the link on our Facebook page, or go to theriver953.com and click the banner at the top of that page and make a donation that way as well. It is also our monthly conversation with Valley Health. We are speaking with Susan Lessar and Jessica Watson from Valley Health about nutrition and the impact that nutrition can have on your health. And before we went to break, I was asking you ladies if we could talk about food deserts, and we chatted about it briefly during the break. I've seen a lot on the news about food deserts. Normally it's communities in some of your larger cities not having grocery stores. And I said, do we even have food deserts in our community? And Susan, you explained to me that we do and what they are. Can you tell me about that again?
Sure. In downtown Winchester, I would say if you can look it up online, and they will pinpoint areas that are considered a food desert. And the downtown Winchester area is considered one of those due to the lack of groceries and fresh fruits and vegetables.
And it was interesting because I hadn't thought of it from the perspective about transportation. You mentioned that when the Dollar General used to be on the downtown walking mall, people who didn't have transportation and lived in the downtown area could walk to the Dollar General and pick up some grocery items. Granted, they couldn't get fresh produce or fruits or vegetables, things along those lines. I had never really considered the transportation issue in a food desert area because I can just get in my car and go to Walmart, go to Martin's, go to the grocery store. So that does play a pretty large role in somebody's access to get food.
It definitely does. And when that Dollar General closed on the walking mall, it was definitely a blow to our individuals in the community that don't have transportation. However, we did have another Dollar General open up just a few blocks down the street on Amherst Street. So that is a great opportunity for food for our individuals that lack transportation. There are, as we know with COVID, opportunities to have food delivered, but if you have an issue with transportation, you might also not be able to afford that luxury of having groceries delivered to your home. So it is nice to have the access to food within walking distance.
Well, and it's interesting, too, that you point that out, because I've never really considered Dollar General to be a grocery store. And there are Dollar Generals popping up everywhere. And I've read that that's one of the reasons why is that they pop up in some of these smaller communities, because there is the need for some sort of grocery options in those smaller towns.
Yeah, and I will say it is nice. I was actually in a Dollar General about a year ago purchasing food. And the reason was Valley Health had a wellness event in the Apple Blossom Mall, and they asked me to go against a local chef. And the challenge was we had to go to Dollar General and purchase food and make a healthy entree. And then we made it right there in the mall. And so when I was there, I was surprised actually at the number of foods that they had that were more nutritious than what I had recalled. And then they also had a refrigerated case with dairy products. And so I feel like while it's not I wouldn't consider it a regular grocery store, it's definitely better stocked than a convenience store.
We have a Dollar General here in Middletown, and my husband and I refer to it as the Middletown Mall, because that's where you can go to get a little bit of anything that you need, no matter what time of the day. So we talked a little bit, too, in the first segment about community gardens. So before we get into the community garden conversation, do you encourage your patients, if possible, to start a garden in their backyard or on their windowsill? I mean, what kind of impact does gardening and growing your own fruits and vegetables have on somebody's ability to have a healthy diet?
Absolutely. We do encourage patients to partake in doing their own window box or garden if they have the means to do so. Growing a garden can be a stress reliever. For some people, it may be a stress producer, I guess, if you feel like you don't have a green thumb. But for the most part, it gives you an activity that you can maintain and grow something. It's recreational. If you're outside in the garden, it can be considered exercise when you're harvesting or you're digging up the dirt. And so there's different things to keep you active, as well as the health benefits from the food and fruits that you can grow.
Now, in my notes, it says that both of you have worked with James Wood High School students, Go Colonels, on the community garden that they have at the Museum of the Shenandoah Valley. I understand Valley Health has a 3-year community health impact grant that was awarded to Daniel Morgan Middle School and PACA in Page County. Tell me about the community garden at the Museum of the Shenandoah Valley.
So yes, back in 2017, Susan and I were talking about chronic disease and nutrition and education and looking at different ways that we could partner in the community to bring some of that to patients who didn't have the means to work with the garden. So we partnered with James Wood agricultural students and the Museum of the Shenandoah Valley. And between the three of us, we were able to find the resources and the support to grow gardens for fruits and vegetables at the Museum of the Shenandoah Valley. We actually offer a grant for a student every year who applies for a garden manager position. They go through an interview process and we select a garden manager, and then they help us run the community garden for the year by harvesting the foods weekly, by helping with the distribution of getting it to the patients who need it.
I think it's great that you get the kids involved the way that you do, because that teaches them so many different things on so many different levels, not even just from a gardening perspective, but you're kind of teaching them a little bit of business skills and learning what they should plant and distribution, and you're teaching them how to give back to their community. I mean, that checks so many different boxes.
Yes, and the students also use their connections to the school and different community events, such as their local churches, any organizations that they're part of. And they, prior to this 2020, would look for volunteers to help work the garden and encourage that gardening, and even taught a class that we recorded for people to learn about gardening so that they could do it whether it was at the community garden or in the benefit of their own home.
Now, in the middle of this pandemic, I mean, things are still growing. Obviously, that doesn't have an impact on whether or not the tomatoes are going to come to fruition. How have you guys had to kind of tweak what you're doing with the community garden because of the pandemic? I'm guessing you can't have a ton of volunteers in there all at one time now.
Correct. It limited the volunteers, so we really heavily relied on our community garden manager this year, which is Caitlin Garris. She's a senior at James Wood High School. And she would go and she would harvest the food and she would connect with Susan and I, and then Susan and I would look for different venues to distribute the food. So for example, every Wednesday at Valley Health over the 2 months to 3 months over the summer, they offered a give-take swap. So whether you were an employee, a patient, or a family member that were in the hospital, you could go to the table where we had all the fruits and vegetables set up from the community garden, and you could take what you needed, bring something from your own home garden, or trade it out, bring something and take something from that stash. Other ways we did it was we used our diabetes education classes and our acute rehabilitation center on Cork Street to distribute the foods to patients who came in for services. And in diabetes program, they give them recipes and teach them how to cook healthy and then send them home with some fruits and vegetables.
Has the garden grown? You mentioned you started it in 2017. Is it the same size, or have you found that because of the need, it's gotten a whole lot larger than it was when you first started it?
It has doubled in size over the time that we've done it, and we've even worked and been collaborating with the Museum of Shenandoah Valley to see, hey, where else can we take this, and how do we increase the scale of what we're doing?
You know, Janet, in addition to what Jessica said, the benefit for the students in terms of the scholarship is that it also gives them a real world example of how to practice what they're learning in school. So, so when they go to this garden, they're able to learn soil testing and crop rotation and how to organic garden without pesticides, and you know, what grows well in our region. So it's a nice hands-on application of the curriculum that they're learning in school.
Susan, do you have any advice or suggestions for people on how they can eat healthier on a budget?
Sure, and it's really challenging because just cooking in general can be really intimidating if you don't know how to cook. So then add on top of that trying to cook healthy and on a budget. So it just makes it really difficult. And what I would recommend is, try to keep your eye open for sales and buy in bulk when you can. And then we also have some really great stores in our area, Dollar General, Aldi, Sharp Shopper, where you can find some really great deals on groceries. And then last, always, consult the internet. There are numerous resources for tips for shopping on a budget, healthy eating on a budget with recipes and shopping guides. So I think all of those would certainly help. And if you have additional questions, you're welcome to reach out to any of the Valley Health dietitians, and we would be happy to help.
What impact does having 3 meals a day have on your overall health? I'm one of those people who I can't eat breakfast. Breakfast is not my thing. I've got to be up and moving around for hours before I even want to think about food. Typically, since I've started the radio show, I don't eat lunch because I'm usually working during lunch, and then I'll have dinner. But not having 3 meals a day isn't healthy regardless of what I'm eating at that one meal, right?
So that depends on what you listen to that particular day, Janet. It seems like, the experts come out every day with a change in what we believed had been true. So when I was younger, growing up as a dietitian in school, we recommended the 3 meals a day, the importance of breakfast, even 6 small meals a day, because when you eat those 6 small meals or even 3 meals versus just 1 meal a day, your body has to burn energy in order to break down that food and metabolize it. So there's kind of a calorie burning benefit to eating smaller frequent meals versus 1 large meal. There's also a theory that when you don't eat all day and you just have 1 meal, then you're going to be really hungry and probably overindulge, which can be a bad thing. But then on the flip side, there's a lot of information out there now about intermittent fasting, where you do go for long periods of time without eating, and that's been shown to be helpful with weight loss. So I think at the bottom line is figuring out what works for you and what works for you long term, because the fad diets and the yo-yo weight loss, up and down, is really what gets us into trouble, because when we lose weight too quickly, we're losing body muscle mass, and that's what puts us at higher risk for malnutrition, and you have less ability to fight infections, and you have poor wound healing, and you're more likely to have a bad outcome in the hospital. So it's a kind of a fine balance between finding foods that are healthy in the right amounts, the right portions, and getting yourself to a healthy weight or staying at a healthy weight.
Well, and you make a good point too, because sometimes those crazy diets may be great in the short term because you drop several pounds, but unless you change your lifestyle and your activity levels and what you eat, when, and how much, that weight's all going to come back anyway, and that's bad for your body too.
Right, and that's where consulting with a health professional or a registered dietitian can help you to figure out what works for you, what makes the most sense for you. I could sit down and give you a beautiful meal plan, a breakfast, lunch, and dinner, but if you don't know how to cook, then that's not going to help you. So if you are going to say that you only eat breakfast, lunch, and dinner at fast food, then I, as a clinician, have to figure out a way to help you make healthy choices and keep those calories within a certain range and try to make the best of that situation. So again, it's all very, there is no one answer, unfortunately. There's no magic answer, and it's really just kind of dependent on the individual and what would work for them.
You're going to be recommending a lot of salads at the Wendy's drive-thru.
Honestly, fast food restaurants are making attempts to offer healthier options, the salads, the grilled chicken, the Impossible burgers. So, I think that, fast food is not going away. So I am happy to see that they are trying to offer healthier selections.
Thank you, ladies, so much for meeting me on the Zoom screen today and giving me so much great information and great advice. I do appreciate the time that you've taken out of your day today.
Thank you.
Yeah, anytime. This was fun.
I will be live tomorrow at the bus. Since we're talking about fast food, tomorrow's show is going to be supersized, and we will be, my show will be from noon until 1 tomorrow. Andrew Shearer, the owner of Royal Broadcasting and our fearless leader at the radio station, is going to be my guest. Larry's coming back from Front Royal, Warren County CCAP. We might even get to talk to Joe Woodall, who was actually the brainchild behind Camping for Hunger so many years ago. So meet me back here tomorrow, a few minutes after noon.